Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here, and today I want to talk about the lower trap as it pertains to neck pain and shoulder pain. Now, I'm not saying the lower trap is a cause necessarily of the neck or shoulder pain, but it's a common feature. And it tends to be, I would call, like the weak link in most people's shoulder and neck function. The lower trap sits on the bottom part of the scapula, and it pulls the scapula downward into depression. It rotates it up into upward rotation when you're reaching overhead. So think of the way your shoulder blade kicks out when your arms go up. It does that. That's upward rotation. It does retraction of the shoulder blades, and it does posterior tipping. Posterior tipping is, if you picture the bottom part of the shoulder blade, it tips downward and into the rib cage with certain motions. The opposite is anterior tipping. So if you're in a slumped position, aka poor posture, the shoulder blade kind of tips forward, and that's anterior tilt. When I test my athletes, that's one of the most common findings is the lower trap is significantly weaker than most of the other muscles of the shoulder complex. And it tends to be the weaker side, the weaker lower trap from left to right, tends to be the one that is the side of the issue. Now, the why behind it can be complicated, and it can be definitely theoretical. So let me go into some of the theories that I have. So I like to think of the lower trap as having some adversaries or opponents. For example, I mentioned the anterior and posterior tilting, the lower trap doing posterior tilt. The opposite muscle is the pec minor does anterior tilt. So I kind of think of those as adversaries that can compete for each other, compete for the action. Also, the upper trap and lower trap compete in a couple ways, but mostly if you think of upward elevation or shrugging your shoulders, that is the opposite of depression of the shoulder blade, which is what the lower trap does. So those two fight for space. The levator scapula attaches to the top part of the shoulder blade, and it does downward rotation, which is the opposite of upward rotation, which is what the lower trap does. There are other muscles that assist in all these motions too, but those are the ones I see as the main culprits that antagonize the lower trap. So the why behind this, I would say two things come to mind. One is posture and one is breathing. So posture, as most people know, our society just sort of sits forward in front of a computer, rounded shoulders, holding onto a phone or tablet or working on your laptop. So all those muscles sort of that are the antagonists to the lower trap tend to be very facilitated in different ways. So that rounded shoulder position and slouched position is going to really facilitate the pec minor from getting stiff. The sort of chin up, forward head position, the upper traps, and the levator scapular are basically going to be passively holding onto your skull for dear life to keep everything attached, whereas the deep neck flexors are what should be keeping you into a good position. So basically all those muscles get kind of stiff and achy. And let me just pause right here for a moment. There is something called upper cross syndrome. It's an old idea. It's sort of a template to sort of view the upper quadrant in the body. And basically the idea is the muscles I mentioned, they would say are stiff, and the ones that, like the deep neck flexors in the lower trap, they tend to be weak. So it's kind of a picture of a X if you're looking at someone from the side. On one axis you have stiff muscles, the other axis you have weak muscles. And the idea it would be to stretch the stiff muscles and strengthen the weak muscles. That kind of works a bit, but if you really get down to why some of these muscles are achy, like the levator and the upper traps, it tends to be not necessarily a stiffness issue, although the muscles may feel stiff. It tends to be like a lack of oxygen because they're either overused or they're on this low load long-term stretch. So they kind of the blood gets squeezed out of them and they start to lose oxygen. So I rarely recommend stretching those muscle groups. It's more about getting blood flow to them and turning on some other muscles to get you into a little bit of a better position. So that's sort of the postural lens. But the other one that I think is actually more important is breathing. And I say breathing because it's probably the most common dysfunction I see. I always look at how someone breathes as soon as they lay on their back. I don't tell them because then it changes how they do it. But most of the time, people are doing what I would call more of a sympathetic breathing style, which is chest dominant, right? So you should be at rest in parasympathetic state and be more belly dominant. So as you inhale, your belly should rise. And then secondarily, your chest or rib cage would rise. But what I see constantly is the opposite pattern where the chest rises first, then the belly. And that pattern leads to a lot of stiffness in the muscles that attach to the rib cage. And some of the muscles I'm talking about, like the upper traps, do not attach to the ribs. But all you have to do is look at how someone breathes. You can see their shoulders rising, which is what the upper traps do. Pec minor does attach to rib cage, so that is definitely involved in it too. And the levator scap is assisting as well. So the whole upper quadrant is just sort of heaving and leads to a lot of repetition. And it might seem like a small thing, but we take something like 30,000 breaths a day, depending on your breathing rate. So you can imagine you do any movement 30,000 times a day, it's going to get sore and achy. So that's the why, in my opinion, why this pattern develops. And this pattern can turn into other issues. So if your shoulders are kind of chronically elevated and you don't have good upward rotation of your shoulder blade, which I want to talk about more in a second, that can turn into something like a rotator cuff impingement and maybe a rotator cuff tear if ignored. If the neck muscles are sore and achy because of you're sitting in a poor position for 40 hours a week or more, that can turn into neck issues and compressive type issues. If you have this dominance of the upper trap, especially when you reach overhead, when both upper traps turn on, because they attach to your cervical vertebrae, they can kind of compress the cervical spine together, creating stenosis. This is one of those scenarios where it's small patterns over time create repetitive load and turn into sometimes some nasty issues. Now, this is where it gets a little confusing too, because I think a lot of the health and wellness community has said, okay, well, we got to, sit up straight and keep your shoulders down and back. Well, first off, I don't think you can just will yourself into good posture. You have to strengthen things in a certain way so your resting posture naturally lands in a better position. So posture, I think people get really down on themselves about posture. It's not a willpower thing. It's fix the imbalances, strengthen the muscles that tend to be weak, and then it'll start to go away. The down and back thing, that's a cue I hear a lot, and sometimes I do use that cue. Keep your shoulder blades down and back. In certain scenarios, when someone is having a lot of upper trap pain and we can't get their lower trap to turn on enough or the way I want it to, then I'll kind of cue that. But I always tell my patients, look, right now we're doing this to let your shoulder, your upper traps cool off. But you shouldn't just keep your shoulders down and back at all times. So you can't have this like packed in position, because then you can't upwardly rotate your shoulder blade when reaching overhead, and that creates other issues. There's a lot of confusion around this topic. What you do in your rehab stages of things is going to look different from your everyday training, right? So we may have you deadlift, for example, with a flat back to let things cool off until you can get back to lifting the way you want to, and then you can start to add in some variety of movement. So this shoulder blades down and back cue I use sparingly, and I just make sure to educate this is a temporary thing. So how do we correct this? How do we address the situation? So first of all, there's an acronym called MAPS I got from a buddy named Dr. Roger St. Onge, who's a great therapist. It stands for movements, activities, positions, and situations. So you look at your MAPS that activate or irritate the tissues. Again, it's movements, activities, positions, or situations, and see how you can reduce the frequency of those things. So if it's positional, like work, right, sitting at a desk, you got to take breaks. If it's situational, maybe it's an overhead press. Maybe you're doing a bilateral shoulder press, and that is what irritates it. Well, maybe you have to switch to unilateral, or you have to lighten the load temporarily. So that's step one, is stop provoking it. Let those tissues cool off. And then step two, I usually will do some form of desensitization, meaning massage or foam rolling or something to make the achy tissues feel better. That has an effect to not only make the person and athlete feel better, but also tends to downregulate the tissues that I'm trying to not turn on as much. So I will do some soft tissue work at the levator, scapula, the upper trap, or the pec minor. And then finally, I will try to get the lower trap to engage more. Now, I don't like this idea of like amnesia, like muscles like forget to work. I think it's just you're playing with percentages. Like maybe in a overhead press, the pec is on X amount of percent and the lower trap is engaged X amount of percent. You're just kind of playing with ratios. It's really hard to specifically isolate a muscle, but you can use cues and things to try to get a movement that facilitates a certain muscle or muscle group to work a little better. The lower trap is a notoriously difficult one for people to understand how to turn it on or how to get to engage a little firmer. So I meet the person where they're at. So sometimes it means I'm just having them doing some scapular depression. It could be as simple as just sliding their hand down towards their knee just an inch or so. That will do scapular depression. And sometimes it'll take like 2 or 3 sessions of a lot of repetition, eventually adding load until someone starts to feel that muscle engage. And actually, before I even do any of that, I do try to work on the breathing as well. So if they're chest dominant breathing, I might spend a session or even 2 just trying to teach them how to breathe diaphragmatically. This can be surprisingly difficult for people, especially athletes, for whatever reason. Maybe because they're in a constant sympathetic state because they're training so hard. I'm not really sure. So after I've sort of fixed their breathing, or worked on their breathing, I should say, I would do more things to teach them how to activate a lower trap. So external rotation of the shoulder can be a good way to do it too, by the way, because when you externally rotate, specifically with the arm abducted to 90 degrees, you get posterior tipping of the shoulder blade. So I'll usually start with that on your stomach. So you're prone on your stomach, and your elbows are above your ears. Your hands are close together, so your arms are look like they're in kind of a diamond position. And then I'll cue for some external rotation and sort of tap the lower trap and say, tip your shoulder blade down into the rib cage. At this point, if they can really feel that lower trap engaged, I know I can get them to move the way I want them to. And then I'll start to combine things. I'll start to combine the breathing with the lower trap activation. That's where it gets fun. It gets super challenging. So many athletes will hold their breath during movements, especially when they're concentrating. So I will typically make someone do the movement I want or the effort on exhale. And then at that point, it's all about grooving that pattern. Lots of repetition, low load. So it's 30, 40 reps or something multiple times a day until they really get a good motor pattern down. Then at that point, that's when I start to load the position, load the movement. Then they get to keep it. And then finally at that point, it depends on their goals, then I'll try to dynamically stabilize it, dynamically strengthen those muscles. That's where I start to do the motion they want to do and add a variation of like force. So like picture pressing overhead and learning to engage the lower trap while having something pulling on your shoulder in multiple angles. So you have to keep engaged under like a dynamic situation. That tends to be a little more complex. If you feel like you need help with this stuff, just give us a call. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called PHYSIOLOGIC Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.